What liver markers show fatty liver disease? Imagine your liver as a busy factory working non-stop to keep your body running smoothly. When fat starts to build up in this factory, it can cause some signs that show up in blood tests. These signs are called liver markers, and they help doctors understand how healthy your liver is. The most important markers for fatty liver disease are to enzymes called alanine aminotransferase and aspartate aminotransferase. These enzymes are normally found inside liver cells, but when the liver is inflamed or injured, they leak into the blood. If your blood test shows that your alanine aminotransferase levels are higher than normal, especially 1 to 4 times above the upper limit, it suggests your liver might be experiencing some damage related to fatty liver. Keep in mind, having normal levels doesn't completely rule out fatty liver, but elevated levels often lead doctors to investigate further. Aspartate aminotransferase is another enzyme that can be elevated in fatty liver disease. It's less specific than alanine aminotransferase because it can also come from other tissues like muscles. Usually, in non-alcoholic fatty liver disease, the ratio of aspartate aminotransferase to alanine aminotransferase is less than 1. If this ratio increases, it might suggest the liver is progressing to more advanced stages. Another marker that can be elevated is gamma-glutamyl transferase, or GGT. This enzyme is involved in bile flow and liver detoxification. When GGT levels go up, it can indicate some injury or stress in the liver or bile ducts, often rising alongside the other enzymes. Alkaline phosphatase, or ALP, is sometimes mildly elevated in fatty liver disease but isn't used alone to diagnose it. It's more useful when combined with other markers to get a full picture of liver health. Beyond these enzymes, there are more advanced tests and scores that doctors use to assess how much scarring or fibrosis has developed in the liver. For example, the Fibrosis-4 Index combines age, platelet count, and the liver enzymes to estimate fibrosis severity. A higher score suggests more advanced scarring, which is important because fibrosis can lead to cirrhosis and increase the risk of liver cancer. Imaging tests like ultrasound, fibroscan, MRI, or CORT scans are also helpful. They can show how much fat has accumulated in the liver and whether there is significant fibrosis, but they don't measure blood markers directly. Monitoring these liver markers over time is vital because persistent elevation of alanine aminotransferase and aspartate aminotransferase, especially when combined with signs of fibrosis, indicates ongoing injury. This ongoing damage can progress to cirrhosis, which raises the risk of developing liver cancer. Early detection allows for lifestyle changes, such as improving diet, increasing physical activity, and managing metabolic conditions, which can slow or even reverse some of the damage. In summary, the main liver markers that show fatty liver disease are elevated alanine aminotransferase and aspartate aminotransferase enzymes. These are often accompanied by changes in gamma-glutamyl transferase and sometimes alkaline phosphatase. When combined with imaging and clinical assessment, these markers help doctors diagnose, stage, and monitor fatty liver disease to prevent serious complications like liver cancer. Always remember to consult healthcare professionals for personalized advice and appropriate testing.